Hello.
Here to talk about telehealth therapy, AI, and mental health, how that all intersects. I'm going to do brief introductions for the panelists and then let them introduce themselves. Nikolai, Emily, David, Flor, and Holly. We'll start with Nikolai if you want to do a quick intro and just tell people who you are and what you do.
Good morning, everyone. So happy to be here. Hope you're all having a wonderful event. My name's Nick Vassiv. I'm a tech entrepreneur working in the field of digital health. I got into psychedelics due to a personal experience, and this medicine really changed my life. About 6 years ago, I fell on jagged rocks and fractured my tailbone, which led me to a deep depression. And I looked to psychedelics to heal. And at the time, I'd actually visited a clinic in the Netherlands called Synthesis. And at Synthesis, wonderful experience. However, I needed some integration. And at the time, there was just a forum with some email addresses of integration specialists. And having a tech background working in data analytics and cybersecurity for over a decade, I wanted to build an application to help connect psychedelic integration specialists and psychedelic users so they can have a safe experience just as I have. So I built an application called MindLeap Health. At the height of it, we had about 100 integration specialists, 30,000 users, thousands of lives changed, and I ended up selling the company to a biotech company that took it in a completely different direction than what I envisioned. So I ended up leaving. Now I've founded a new startup called NovoBeing. We're revolutionizing stress management with immersive multisensory meditation. And if any of you are interested in virtual reality and wellness and are avid meditators or want to become meditators, come see me, and I'd love to show you a demo.
Hi, everyone. My name is Emily Zaccardi. Very glad to be here. I've been learning so much from all of you for the past 3 days. I'm a consumer tech founder. I got into tech about 6 years ago. Before that, I had a marketing background. And here I am leading Kai's marketing, Kai.ai. We're an amazing AI company that is helping people develop a greater sense of self through ongoing reflection facilitated by an AI conversation. And overall, my motivation is to find the intersection between psychological safety online and user experiences that are fun, exciting, things that make people feel special in a really authentic way. So again, glad to be here.
Hi, everyone. David Mo, great to meet you all. I am CEO of Cerebral. We're one of the largest telehealth platforms for mental health. We've treated over 750,000 Americans now in both therapy as well as med management in all 50 states. I'm super excited about interventional psychiatry, ketamine, Spravato, psychedelics, MDMA. I'm involved in a ketamine clinic. I'm an advisor to Osmind and Compass and Janssen Pharmaceuticals. And I believe that the future of mental health and well-being will be a combination of both digital health and telehealth, as well as those interventional psychiatric treatments based on what's best for the patient. Great to be here.
Hi, everyone. My name is Maria Florencia Bollini, but everyone call me Flor. I'm a medicine woman and entrepreneur, and for the past decade, I pioneered the feminine way of serving 5-MeO-DMT. During this decade, we ran a solution underground that now we are taking at scale. I am the founder and CEO of Nana Health, that is introducing what we call psychedelic-initiated transformative medicine, empowering people to heal themselves, combining lifestyle practices, community, and AI. Thank you.
Hi, everyone. My name is Holly Nelson. I am a partner in a ketamine telehealth company called Psychiatrist. I am also the CEO of a mental health app, self-discovery app, really, called Truth Map, or like a GPS for your mind. And I'm also the only woman in America that owns an MMA fight league that has both male and female athletes. And psychedelics is something that I have been interested in for about 2 years now, and studying it and how it helps with motivation, but also TBIs, traumatic brain injuries, in professional athletes. And so I'm just happy to be here, honestly.
I love being the dumbest person on stage because you're going to get a lot of great answers out of these esteemed colleagues. We're going to start with Flor because the elephant in the room. The elephant in the room is mental health. We're clearly experiencing a crisis on that front. How, in your opinion, does technology, AI, digital solutions help address that?
So, serving medicine for a decade and being the sole responsible of holding someone's transformation show me that it's impossible to hold someone in that way. Once, you have a psychedelic experience, I was, in charge of serving the most potent psychedelic compound, right? That in many cases there is no God, then there is a God, and you are God in 5 minutes. So then how do you hold space for that person that their whole belief system and understanding of life has been shattered? Like, even if I had all the knowledge that they needed, in order to rebuild their life, it was impossible to impart it, in talking. So, intuitively over the decade, I started putting together resources that I felt these people needed according to what they needed to heal. And one of the things that repeated itself a lot was around sexuality, healing sexual trauma or connecting with your life force. And so Tantra and ancient practices of healing became one of the topics that were, coming to surface that people needed to start integrating in their life, as well as psycho-spiritual integration, right? How do I make sense of this experience that I had, right, that now is a direct connection with the divine? And so over, understanding about technology, I came across the work of Sugatra Mitra, this Indian educationalist who developed this theory called child-driven education that he tested around 5 continents, where he observed that kids would learn much better through online content, where the teacher, rather than imparting all the knowledge, would become a mentor and a cheerleader, where the kid would go through the process themselves and stimulate peer-to-peer support. So what we are working on now is basically extrapolating this concept into psychedelic and standardizing all the content of what we as practitioners repeat as parrots in engaging online content and empowering the person to be, you are your shaman, you heal yourself. We are here to support you. Meantime, you do the work, and technology can have this incredible role to make it accessible, so you can be supported at home where you need it the most, when you are alone, when your therapist cannot pick up the phone. And also in this way, you can tap to the power of the group to learn what positive outcomes are working for people like you.
And Holly's going to come in hot with the devil's advocate approach. The human connection and the administration directly. How does technology potentially hinder healing?
Well, I think that's why I wanted to talk about it. I don't know if, usually if you own a company that does something, you're not going to get on stage and say, it probably doesn't work that well, or maybe we don't even know anything about it. But I think that that's why we have to talk about it. Is there research that suggests that psychedelic integration work or psychedelic guided online therapy is less effective than in person? And I think that that really comes down to, like, do you miss the heart-to-heart connection when you're on, a platform, you're on Zoom? We all know that, like, during the pandemic, just losing that in-person connection in general was hard for us. So how does it work when you're now trying to do something like psychedelics with a practitioner, and you're on a computer and you're looking them in the eyes, but you're not there in the room with them, so you can't really feel that energy. So does that take away or hinder your psychedelic experience? And I think that just starting the dialogue around it would be the first step, and number two would be to do the research, and let's figure out how effective telehealth is in this space. It's all new. We are all finally coming to market with products that, like you said, you were underground for a little bit, right? And I think it's up to us to figure out if what we're doing is the right approach, and it's our responsibility to discuss it.
Learning in real time. David, you mentioned the two pathways to this, and there's clearly divergence between the two, but can you maybe speak to what the options are and how people could view it from both sides?
Yeah, sure. Maybe what I'll say is here's a vision for where mental health and wellness will be 10 years, 5 to 10 years from now. Most of outpatient therapy and medication management with Prozac and all those others will be online. There's no reason. Every psychiatrist who has an in-person practice, that's going to be a thing of the past. However, there will be these interventional psychiatric clinics, right? These are the ones that today provide ketamine, Spravato. Next year, we'll provide MDMA. In a few years, we'll provide psychedelics as well, right? So as you begin to see psychiatry have two different models of care, the question is, well, how do you want to deliver this care to patients? And the idea here is that any patient can come in at any point, and you get triaged to the right level of care, right? So for example, you bring in your insurance card, you need help, you feel depressed, you try therapy, you try an antidepressant, it doesn't work. You try another antidepressant, it doesn't work. Now your insurance will pay for ketamine, for Spravato, for MDMA, for psychedelics, right? And then you get referred to a high quality clinic below. And it's all integrated. So what I would say is that the future of mental health is very much using data to predict what's the best outcome, what's the best treatment for the right patient at the right time, at the right place, and then bringing that there. And to a point that was made earlier, we have to measure outcomes and make sure that we're driving towards outcomes, right? So it's a very optimistic view of where things are. And I failed to mention I'm a psychiatrist by training. I'm just so blown away by some of our treatments which work very well, and some of our treatments which work very not well. And I've seen the outcomes coming out of the psychedelics and the ketamines and these types of medications, and there has to be a marriage of the two in order for this to work. Maybe the last thing I'll say is that one thing I noticed, I joked with my co-panelists earlier in the backstage, there's a cultural difference too between medicine, mental health, therapy, psychiatry, and the psychedelic universe. And there has to be more dialogue between the two universes, because otherwise we won't be able to get to the answer.
Completely agreed. I think this is a dichotomy that I often like to speak about, is it's, medical only or decrim only, and it's you have to pick one path, or the spiritual and shamanistic side, and there's very clearly defined categories. But to me, I like to break it down to even on the recreational side, the root words are to recreate. And that's what medicine is trying to do. And spirituality is really just help you recreate yourself. And so it doesn't have to be, a purist, one path is the way to go. I think this kind of a conversation where we can be open to each other's ideas and synthesize makes a ton of sense.
There's a large common denominator to your point, and it's we want people to feel better. We want them to do better. We want them to be themselves and fully actualize themselves. And there's a common denominator there. We have much more in common than we have in different. So I look forward to continuing that dialogue.
Absolutely. So Nikolai, COVID happened. That was a fun one. Social isolation run rampant. I personally noticed a very direct correlation between the psychedelic medicine industry ramping up with speed and mental health declining with equal vigor. Can you speak a little bit about that and how it impacted humans in their current state?
Yeah, great question.
You gave it to me.
I find that the rise of telemedicine was really brought forth due to our inability to connect. And as technology evolves and smartphones have become ubiquitous, internet is extremely fast, we're really able to deliver care to people that are in rural areas and people that are in situations where they wouldn't have been able to actually use psychedelics. If you think about it, there's an enormous stigma for psychedelics. The movement is growing, however, it's still something that, it's a little bit weird, for many people that are not in this conference, if you say, hey, I'm doing DMT, I'm doing psilocybin, and how do people really have somebody that they can talk to in a safe and secure place? And this is where these digital platforms come in. And doing psychedelics right is really important because they are extremely powerful consciousness expanding molecules. And sometimes if your introduction to it turns into a bad trip, you really are unable to unlock the entire potential of this. With the rise of artificial intelligence and amazing chatbots, it's really interesting how people are able to solve this issue of social isolation using this new technology. What's really interesting is the release of some of these new AI companions that Meta just launched, where you're able to talk to Snoop Dogg, Kendall Jenner, where that's really showing that there is a demand for this. And a recent Harvard study actually showed that about 35% of people are feeling isolated most of the time. And this is when this technology will be able to impact. But it's still new, and we really need amazing platforms, like Cerebral, like Nana, that are able to provide this care because it is much needed.
Great segue. Over to Emily. So Emily's with Kai AI, and it kind of speaks to that point of social isolation, and part of that is being in relationship with community, but I think a bigger part of it is being in relation with yourself and a good relationship. How is it, AI can be a really big awesome word or a big scary word, but how can AI, specifically Kai or otherwise, help humans get into better relation with themselves and with their brain?
Yeah, absolutely. I think as I've seen the work that we've done at Kai, what it comes down to is building technology with a set of ethics, a set of principles, remembering that just because we can do certain things technologically doesn't mean that we should. Let's keep in mind at the root, what is good for the consumer. When I think about the surge of social media, which changed things forever in a lot of good ways and also in a lot of ways that have negative side effects, we've realized that without some of the guardrails in place, things can go off of the rails. When it comes to Kai, we make sure that this technology is something that asks smart reflection questions that are really personalized over time so that people can develop a greater sense of self. In other words, our technology, our AI companion, like you were describing, is designed in such a way so that you wouldn't become addicted to it. And I'll give you a specific example. Let's say you were kind of talking with Kai for hours, which, that would actually be kind of an edge case because Kai nudges you along the way and says things like, hey, David, I noticed that last week you had an argument with your brother, and I wanted to know how that went. What happened with that? Did you end up talking with him? What did you decide to do? And the reason I'm sharing this example is because Kai takes an approach to reframe the conversation into something that aligns with our company's values, which are connectivity, expression, authenticity, courage, things of this nature that I at least believe are some of the best parts of humanity. So yeah, it's really important to us that we're building technology ethically and responsibly so that we can get usage. Usage of a product is what's actually going to lead to results in terms of having metrics to measure. But if we over-tool a product to only get engagement metrics, we might not be holding ourselves accountable on the well-being side of things. So fortunately for Kai, we're founded by 2 psychologists that actually have treated people in high schools and private practices, and we've been able to take a lot of their passion and their learning and put it into this product that really just tries to raise the base layer of well-being for each individual. And then when we imagine that at scale, it's raising the base layer of well-being for everybody because of some of the themes that we've talked about on this stage already, like accessibility. People in rural areas, like they don't have access to some of the most amazing resources that are available. Actually, in one of our user interviews that we conducted at random, we heard from a boy in a rural area of New York who said, I'm a member of a family where 3 out of my family members are hard of hearing, yet I am able to speak and I'm able to hear. And although I sign and I'm able to communicate with my family, I don't really have anybody to talk to about the fact that I'm different from the others. But I started talking to Kai, and now I'm able to actually get some of those thoughts and feelings out in a way that I feel is confidential and I'm not going to be judged. And in that sense, it's kind of like smart journaling in disguise, where the experience always goes back to those roots. The more that somebody talks with Kai, the better relationship they have with themselves. And at least on our team, we know that we can feel really good about those usage metrics because we're not tooling for addiction. We're trying to get people at a place where they are getting closer to self-actualization, like you were describing, right? Do I have more awareness of who I am, of the things that are in my mind, what makes me who I am? And that's why at the core, we're a consumer DNA, because where people are spending their time on their phone probably isn't going to change. We can't change the environment, but we can add tools to the environment that help people get a greater sense of self, so that then when they are on TikTok or on Instagram or on Snapchat and they feel those social pressures, maybe they're more apt to take it or leave it because they've done their chatting with Kai in the morning and have a greater sense of self going into that online experience. So thank you for asking.
So we've got about 3 minutes left here, and those are all the prepared questions that I put together 5 minutes before the panel. But I'd like to throw out a freestyle, group-style question and talk about the impact that technology or AI or the digital therapeutics, telehealth, any of that, the most profound or impactful or just heartwarming stories that have come out of the work that any of you have done. And I know you probably have one, so you can start.
One of the greatest things about being in this field is receiving the emails and the reviews of the lives changed. And I think that being able to provide impact by building a technology is truly remarkable. I guess one of the most recent amazing things that I've heard was we're conducting a clinical trial with the University of Calgary where we deployed our immersive meditations to cancer patients that are experiencing chronic cancer pain. And it's a small 20-patient study, but the data came back extremely positive, and there was enormous drops in perceived pain, anxiety, depression, but actually reading the interviews about how we've been able to really improve somebody's life who's in the most stressful times using our technology has been really impactful. And I think that's probably what drives us all, is really making a difference with this technology. And I think as the psychedelic space evolves and as technology evolves, we will see the positive use of technology versus some of the negative uses that we've seen, with the rise of social media and the, egregious impact it's had on mental health for our entire society.
Hot potato, who's got a story?
I could share a quick one. So we had a patient who was getting therapy through telehealth, and he kept on showing up in his pickup truck on his phone. And our therapist said, well, is this okay? Is this normal to have therapy through the phone while they're in their pickup truck? So one day we said, okay, let's ask him why. And he said, well, I don't make enough money to have a private office at work. I don't feel comfortable telling my wife and my kids that I have severe depression. So I need you to meet me where I am because I'm sick and tired of meeting you doctors and therapists where you are. And that became the motto of our company. We have to begin to meet patients where they are instead of demanding them to meet where we are in medicine.
I love that. I see final words.
Yeah, I do. It was great what he just said. And did you say he was a veteran or?
It wasn't a veteran.
No.
It was someone in the rural area,
Oh,
rural
okay, got it,
medicine
got it,
as
okay.
well that we were talking.
Well, I think that's what I wanted to speak to was veterans. I have a big heart space for them, and the best story I have is this man who is a veteran, fully functional, CEO of a company, in sales, hadn't cried in 30 years. Hadn't cried in 30 years. And he did one ketamine lozenge with one of our therapists and broke down in tears. And didn't have any problems in his life, right? It wasn't impacting how he functioned. He just didn't know it, right? Like he didn't realize that he wasn't living his life to the fullest, and changed his whole world. And I think that when we talk about meeting patients where they're at, we also have to understand that like they don't always want what's best for them, right? People don't always want what's best for them, and so we're supposed to also educate and hold heart space for these people in a clinical setting. It makes sense, but we also have to be like heart focused as well, because that is what the medicine is at its core, right? So I think when you talk about like success stories, you have to think like how heart centered are these people now after this experience, and can we get them to that place where they get over the stigma of psychedelics and realize that like they can cultivate self-love, which at its core becomes better mental health.
And I would add over thousands of anecdotals, but still it's a large number. We've seen working with Dr. Martin Polanco, who specializes in veterans, more particularly Navy SEALs, that tend to be the more complex cases to heal because they have all conditions in one person, including TBI. We've seen that people with our protocol goes from -10, I cannot wake up from bed, to 0, I don't qualify more with the condition, and with the same protocol they go +10. Climb the Kilimanjaro, become a leader in their community, really going to impact. No one that heals, stay at home, content. There is this human quality that we have, of really thriving. And as we heal, the full turnaround of 180 degrees. So it's very hopeful to see that as now technology will allow us to change life at scale, we really have an opportunity with the, challenge that we have at this pivotal time. Is not by chance that we have this renaissance of psychedelics. This is the way of the earth of reaching out for us to help ourselves, right? Not to extinct ourselves. So I think it's really promising. And to your question, I think the challenge we have with Western medicine is that now you are going to learn that what drives outcomes with psychedelics is the mystical experience. So how we are going to allow Western medicine to update itself to include the mystical experience into Western medicine approach. So our solution focuses into taking the care out of the clinic into the community and into the culture to empower people to heal themselves. You are your shaman, you heal yourself. You have the power to make that turnaround no matter where you are at. And I think that that is the most exciting thing that we have in this industry as a society, and I think it's a great responsibility to work together and walk that path. So yeah, thank you so very much, everyone, for being here, and thank you for your work.
Absolutely. One of my favorite quotes, "'Tis neither good nor bad, but thinking makes it so." So if we can think together, we can grow together. The worst part about a panel is there's never enough time for the brilliant minds to say their piece, but we are over time. We're going to hop off and welcome you to the next session. Big round of applause.